the frontline workers and the program directors to the table as well. That way you get good input. We also told them that it was a one-year commitment, that it was going to take a series of roundtable discussions to come up with outcomes and indicators and a measurement tool that we could all collectively use. So what we did was we created these roundtable discussions, and we asked the program partners to agree on a set of common outcomes and indicators that were purposeful for their audience. Our youth development partners really had great discussion around the different outcomes that they all used, but how very similar those outcomes actually were. So somebody may have been looking at attendance, and somebody else may have been looking at the number of times the child was sick. And what it was is really defining the correct and appropriate language that covered the indicators that everyone was looking to measure. They were also asked to create a survey tool. Now, some people like this, some people don't like this. It's really, it is very subjective. And I know, Regina, you had asked a question about more community level outcome measurement, and we sort of have two branches. We have this community outcomes project, and then we have our Teen Pregnancy Prevention Oversight Committee, which looks at reducing teen pregnancy by 42% by the year 2015, which is a much broader, much bigger, more community-based outcome. But the Community Outcomes Project is really based on these programs, outcomes, indicators, and a measurement tool that can be used by everyone. The questions, we knew that the questions on the tool, whatever tool we created, we were going to ask that all youth development agencies ask all the questions that were on the tool, not just the one or two questions that were appropriate for them or fit into their outcome area. And in doing this, what we really ended up achieving was a more well-rounded program in each one of these agencies that looked at not only homework help and school engagement, but looked at civic engagement and volunteerism, that looked at resisting alcohol and other drugs, that looked at kids having goals for their future. And although not every single youth development program focuses on each and every one of those areas, it does help them see by collecting this data where they might be able to improve their programming. And that's really, for us, what this whole process was about. It wasn't, looking to see which agency was doing poorly and which agency was doing wonderfully, although we do have benchmark data, and they are asked to achieve that benchmark data based off of what the other programs are doing, but it was really about program improvement. So partners only had to report on one or two outcomes and one or two indicators to United Way, but we received all the data from the entire survey from all of our program partners. The structure, it's a one-year process. We have a pilot year, which is the first year they pilot for 30 days the instrument, the tool, and the outcomes and the indicators. And in piloting that for 30 days, it isn't about the data that they're receiving as much as it is about the implementation. So were their clients able to understand the questions and the outcomes that were being asked of them? How was the tool implemented? What worked, what didn't work? Were all the outcomes that they chose appropriate? Was there any outcome that we missed? And that pilot period is really, really important for us. It really helps us structure those survey tools and those outcomes and indicators to exactly what our target audience needs. The first full year of implementation is our benchmark year. That's the year that we collect all of the data and we aggregate it all together, and we take a look at what that aggregated average is, and that is our benchmark. So 85% of youth attended school every day unless they were sick. And that is the benchmark that gets put into their report in an e-CIMPACT that they have to try to achieve. The next year after the benchmark year is the comparison year. Did they hit the benchmark? Did they not hit the benchmark? If they didn't, what do they think occurred, and how do they want to change what they're doing to adequately reflect that benchmark number? Sometimes it's just as simple as we had a lot of staff turnover, and some of the things that we were going to do we couldn't get to, but we know that if we implement the program properly, that number will go up. And then we have a feedback and review year. So this is a fluid process for us. Anytime there's a pattern of concern, if we read the year-end reports and we see, hey, more than 3 of these agencies are saying the same thing around this outcome and how it's not working anymore, then we call a meeting and we don't wait for the feedback year. The feedback year is really a time to come together after they've implemented this for now 3 years and say, are these outcomes still relevant? Is the language okay? Is there anything we're missing that we need to add? And it's been really beneficial to have that feedback session. I think that the agencies really get a lot out of it, and they feel that it's very inclusive. So what did we do right? We engaged our program partners from the beginning, absolutely. There was no surprises. We didn't just show up one day and say, here's what you need to measure. And the reason we didn't do it is we really felt that we were trying to fit a square peg in a round hole when we did that, and the data we were receiving wasn't that great. And there's really no point in trying to explain to the community what you have going on at your United Way if the data is not very good. We let the programs choose outcomes that best fit their population. We piloted the tool, like I said, very important step. We also included clients in everything that we did. So the clients from these programs, we had focus groups. Actually, United Way didn't, but our agencies would have focus groups with the clients and talk to them about, what do you see in this program? What's most beneficial to you? What do you want to get out of coming here and being here? And then they could bring that information back, and then they knew what it was that their clients were looking for from them, and having the feedback sessions after the pilot. Challenges were really getting buy-in from the agencies. The first project we did, which was youth development, we really had to convince them that this was a good thing. After the first year, we had agencies knocking on our door. When's our community outcomes project? When do we get to be a part of this? We really want to be involved in this. So that was an unintended benefit, I think, is that some of these agencies have multiple programs that we fund, and when one of their programs was in a community outcomes project and the other ones weren't, they saw the benefits of being involved in this, and they saw the process improve their programs, so they wanted other programs in their agency that were funded by United Way to be a part of it. Facilitation of the process. Lots of different personalities. It can make for difficult navigation. If one agency really strongly believes in one thing and another agency really strongly believes that that shouldn't be that way, you have to have a really strong facilitator to be able to navigate that conversation and bring people to a compromise. Some program partners might not be the right fit.